Dr. Roberto Cosentini, who is the head of the emergency unit at the Papa Giovanni Hospital in Bergamo, which is, of course, the epicenter of the coronavirus in Italy. Good to see you and have you on the program. Thank you for making time for us. We've just seen those numbers, and that there could be 10. The numbers could be much, much worse. What goes through your mind when you are struggling already in hospitals?
Well, we are on the day 34 since the start of the epidemic. We started on 21st of February, and we've seen in our hospital more than 1,600 of COVID patients. And we admitted more than 900 of patients with pneumonia needing oxygen. So it's a huge threat for our health system. But what I would say is that with the lockdown, we hope to see a decrease of infected patients and a decrease of the need of hospital admissions. We had the last peak we had was 4 days ago. Now it seems it is a plateau that could be the result of the lockdown and the confinement, which I think it's the only measure to limit the contagion and to limit the surge of the COVID infection in other countries.
And Dr. Roberto, as Sonia mentioned, more than 20 doctors in Italy have died and many others are infected with COVID-19. Why?
Well, I think the virus circulated among us before we recognized it. So I think a relevant number of doctors and nurses got infections before we launched the warning about coronavirus. Many surgeons got an infection when they saw patients before the outbreak, seeing patients without any PPE because it was not.
And when Dr. Roberto, when you look at other European countries, I'll give you an example where I'm from, the UK, and you look at the NHS, what would your message be to your colleagues there at the NHS and also to the authorities?
Yeah, I think the message is twofold. One is the lockdown, because it's the confinement, because social distancing and lockdown are the only way to decrease the spread of the infection. And the other one is the hospital response, because if the emergency rooms, emergency department, and the hospitals prepare the struggle, they can cope with it, because they had to reorganize the emergency department to become a great respiratory unit with a different level of intensity, and they had to pre-empty the hospital to admit the surge of new patients that come to the emergency department. In that way, I think they will get it over.
And your message for people who don't take this seriously, just to quote Dr. Tedros from the WHO, who think they are invincible?
There are no invincible people. We saw also a young patient with severe pneumonia, and it's terrible. I think the social distancing and the confinement is crucial for this struggle.
Dr. Roberto Cosentini, thank you so much for making time for us. Appreciate it.